Good morning, Chair Hageman, Ranking Member Ledger-Fernandez, and members of the subcommittee. Thank you for inviting me to testify on H.R. 630, the Urban Indian Health Confer Act, and for your continued support for the Department of Health and Human Services efforts to improve the health and well-being of American Indians and Alaska Natives. I'm Melanie Egorin, the Assistant Secretary for Legislation at HHS, and my office serves as the primary link between the Department and Congress, including providing technical assistance on legislation to members of Congress and their staff, facilitating informational briefings relating to the Department's programs and policies in support of policy development, and supporting and implementing legislation passed by Congress. In support of policy development, the Office of the Assistant Secretary of Legislation has provided technical assistance on H.R. 630. HHS is dedicated to enhancing the health and well-being for every person in every community in this country. Moreover, we are committed to affirming the relationship between our department and American Indian and Alaska Native tribes for advancing connections, providing expertise, increasing resources, and partnering to improve the health and safety of tribal communities. The department works in partnership with American Indians and Alaska Native tribal communities through a network of over 687 federal and tribal health facilities and 41 urban Indian organizations, or UIOs, that are located across 37 states and provide healthcare services to approximately 2.6 million American Indian and Alaska Native people annually. The Biden administration has prioritized efforts to address the well-documented funding gaps in Indian country, which directly contribute to the stark health disparities faced by tribal communities. Tribal consultation is an integral part of this process. The longstanding recommendations of tribal leaders shared in consultation with HHS and IHS were used to craft budget proposals that secured stable and predictable funding to improve the overall health status of American Indian and Alaska Native people and provide significant investments to direct healthcare services. HHS recognizes that we must continue to work in consultation with tribes and confer with urban Indian organizations and with our partners in Congress. HHS is committed to strengthening this relationship and enhancing coordination and collaboration across its divisions to address American Indian and Alaska Native healthcare access and service delivery within the context of each division's mission. Each division shares in the department-wide responsibility to coordinate, communicate, and consult on issues that affect tribal members. H.R. 630 would amend the Indian Healthcare Improvement Act to establish a UIO confer policy for the department. The bill would require HHS to ensure its divisions confer with UIOs in carrying out laws relating to Indian healthcare. HHS takes its responsibility to consult with tribal governments seriously. As such, HHS's policy specifically recognizes the unique political status of tribal governments, and it is upon this status that nation-to-nation relationships are affirmed through the HHS Tribal Consultation Policy. The Department's Tribal Consultation Policy facilitates collaboration between HHS divisions, regional offices, Indian tribes, to assist with consultation addressing many issues identified, such as access to HHS programs and services. Although the unique federal relationship with Indian tribes is based on a fundamental concept of nation-to-nation relations, statute requires the Indian Health Service confer with UIOs, which serve American Indian and Alaska Native people outside of their tribal lands. UIOs are a critical part of the healthcare delivery system for urban Indians, and HHS supports conferring with UIOs as set forth in the Declaration of the National Indian Health Policy in the Indian Healthcare Improvement Act. In 2014, IHS established the policy consistent with the new authorities provided through the Affordable Care Act. The policy serves as a guide for the agency as it seeks input from UIO leaders on urban Indian health matters. The IHS Urban Confer Policy strives to ensure that urban Indian healthcare needs and priorities are considered at the local, area, and national levels. This policy has been used to ensure the highest possible health status for urban Indians, and the IHS is the only agency within the federal government to implement this formal policy, and it is a best practice and a critical partnership opportunity. HHS through IHS continues to implement its urban confer policy, as well as partner with other HHS divisions to improve access and quality of care. We look forward to continuing to work with Congress on this bill and welcome the opportunity to provide technical assistance as requested by the committee or its members. We are committed to working closely with our external partners and understand the importance of working together to address the needs of American Indians and Alaska Natives. This partnership will advance the shared goals of improving services for both tribal members and the other individuals served by UIOs, and I am happy to answer questions. Thank you.